Are you currently pregnant trying to decide what type of birth you want? I'm Nina Spears, the baby chick, and I've been a doula for almost 14 years. I've attended hundreds of births, and what I have found is that there are a lot of misconceptions about home births versus hospital births. So today I thought it would be fun to go over the biggest misconceptions and set it straight so that you can decide what type of birth experience you ultimately want. But before I get started, be sure to click the subscribe button for more videos like this about pregnancy, birth, postpartum, and parenting, and like this video if you found it helpful. Also, leave a comment sharing your thoughts and questions with us. I so appreciate it. Now let's get started. Here are some of the biggest misconceptions I've noticed about home births versus hospital births. The biggest misconception that I often hear is that home births are dangerous and unsafe. So many people believe that home births are dangerous and only for those willing to forego medical assistance. Hospitals are seen as the safest place for every birth because of immediate access to medical interventions. But the reality for low-risk pregnancies with skilled midwives and a good transfer plan, home births are a wonderful and safe option. Studies even show comparable safety for low-risk women choosing home births with proper care providers. And while hospitals are crucial, definitely, for high-risk births and complications, they can also increase the likelihood of interventions that may be unnecessary, such as inductions or C-sections, which can carry their own risks. And I'm not saying that all inductions and C-sections are unnecessary, absolutely not. Some are medically necessary, but there may be instances when they have occurred because there was a cascade of interventions. When you're pregnant, you are not sick. There is nothing wrong with you. You do not need to be fixed. If you are a healthy person having a healthy pregnancy and a healthy baby, you have more options available to you than just giving birth at a hospital. You can consider a home birth or an out-of-hospital birthing center too. The second one, anybody can have a home birth. So the misconception is people who are considering a more natural and less invasive birthing experience may look into a home birth, but not just anyone can have a home birth. The reality is you have to be low risk. It's true that anybody can have a hospital birth. Low risk, high risk, you can have your baby in a hospital. But if you are wanting a home birth, you must be low risk. Hospital births are really intended for women and babies who have medical problems and are considered high risk because this is where they can receive the medical treatment and have access to an OR if necessary. So if you're interested in a home birth, the midwives that you are going to meet will go over your medical history and look at your overall health to determine if a home birth is a good option for you. So not everyone can have a home birth, not just because not everyone can get through labor and birth without pain medication, but because you have to qualify as being low risk first. Misconception number 3, home births lack pain relief options. So people think that without epidurals, home births leave mothers without any pain management. And the reality is many natural pain relief techniques such as hydrotherapy, movement, hot and cold therapy, counterpressure, massage, hypnobirthing, and breathing techniques are used effectively in home births, helping mothers manage pain in ways that don't require medication. There are even some certified nurse midwives that might have access to a portable nitrous oxide machine or other pain management options. Midwives really have a ton of tools and knowledge and are really there to support you and your baby to have a safe and beautiful birth. The next misconception, hospitals promote a calming birth environment. So hospitals are believed to provide the best, most peaceful environment for childbirth. But in reality, giving birth is one of the most intimate times of your life. Your body needs to let go of tension and allow the hormone oxytocin to flow and really surrender to open and give birth to your baby. And oftentimes, hospitals can feel clinical or impersonal, especially with unfamiliar staff coming in and out of the room, the bright lighting, the different hospital protocols that you might not be aware of. Many mothers find home environment more comfortable, empowering, and conducive to a calm and better birth experience. You're in your home, you have access to your fridge, your bed, your couch, your tub. Whatever will make you feel more comfortable to rock your birth, you have it. Number 5, home births are only for alternative parents. The misconception is that home births are seen as a choice only made by hippies or alternative people, when in reality, home births appeal to parents from all backgrounds who want more control over their birth environment and prefer a more personalized approach to childbirth. I mean, take a look at me. I don't think I'm a hippie, but I might be a little crispy, not full on crunchy. I still shave my armpits, wear lipstick, do my hair, and wear heels, but I do like to have a more natural approach to things. So I had 2 home births. And because I was a low risk mom, had a low risk pregnancy and healthy babies. So they are definitely options for more than just the alternative parent. Misconception number 6, only women with prior birth experience should choose a home birth. Now, it's assumed that only women who have given birth before should try a home birth. But really, many first time mothers, if they are low risk, can choose home births after careful research. They often appreciate that one on one care and comfort of birthing at home. Also, just a side note, when you're having your prenatal visits with your midwife for a home birth, they're usually about an hour long or shorter if you don't need that much time. You don't have to wait in a waiting room forever. They sit and ask you questions about you and really get to know you as a person, your preferences, your overall well-being, and that is a huge benefit. The next misconception, home births are messy and hard to handle at home. I get it. Birth can be messy. People imagine a mess that's difficult to clean up and a lack of necessary tools or equipment to take care of it. But really, midwives come fully equipped and totally handle the cleanup as part of their care. Most home births are managed professionally, leaving the space as clean as before the birth. Every home birth that I've ever been to, even my own home births, the midwives clean up everything afterwards. I couldn't even tell that the midwives and we were there. It just is a happy partner, mom, and baby in their home, comfortable in their bed, ready to get some rest after working so hard and getting their little one. So yes, I know birth can be messy, but it's cleaned up. You would have never known that they were even there. Misconception number 8, home births are only for uncomplicated births. So it's assumed that home births can't handle any complications, when in reality, home birth providers are trained to recognize and manage many complications and have transfer plans ready for issues that require medical intervention. I can attest to this. With the birth of my son, we needed to potentially take me to the hospital because he just wasn't coming out. We had to call the EMT. They were coming up the stairs to come and get me while I was trying to push my son out. And as they were entering into the door, my baby was born, and I was so happy that he finally arrived. But there are plans. They can handle a lot of the things that you may think that they can't. But of course, if they need access to a vacuum or forceps or a C-section, that's when the transfer plan comes in. And that's when, thank goodness, we have hospitals and doctors who can take care of our moms and babies. All right, the last misconception, hospital births are less stressful due to medical support. I understand that having medical staff and technology readily available in hospitals is thought to ease stress for everyone, but maybe not for everyone. Hospitals can sometimes increase stress with frequent monitoring, time constraints, and unknown staff, while home births often offer a more familiar and more comfortable environment with intermittent monitoring and with people that you have met before and have formed a relationship with. In your home with people that you know, your body tends to react calmer. And because of that, you are in more of a comfortable setting. You are then able to progress in your labor, which is what we want, so you can meet your baby. All in all, both home and hospital births have benefits and limitations, and understanding the nuances helps expecting parents choose what best aligns with their needs and comforts. So I hope you found this video helpful. Be sure to subscribe and like this video if you did. And let me know if there are any other topics that you'd like for me to cover in the future. Thanks for watching, and happy birthing.